The African American Legend series highlights the accomplishments of blacks in areas as varied as politics, sports, aviation, business, religion, healthcare, and education. We'll explore how African Americans have succeeded in areas where they'd been previously excluded because of segregation, racism, and lack of opportunity. I'm your host, Dr. Roscoe C. Brown, Jr., and with us today is Virginia Fields, the President and CEO of the National Black Leadership Commission on AIDS. Welcome.
Thank you, Roscoe. And as you was going through the introduction and about the African American series, having been born and grew up in Birmingham, Alabama, it just brought back memories of all of those places we were excluded from. And the very turbulent times during the 1963 civil rights activities, and that just was a flashback.
We have made progress.
We have, but we still have so much to do. You've been the president of the great borough of Manhattan. Absolutely, from Birmingham, Alabama.
and now you're the CEO of the Black Leadership Commission on AIDS, which is so very important for the black community, so much so that the president had a summit, a national program to look at what we need to do in terms of developing a strategy to defeat AIDS in the African American community. You were there, a major participant. What came out of that summit?
First of all, you're absolutely correct that the president has given priority to HIV/AIDS, and that is a phenomenal thing. The president on July 13th released for the very first time a national HIV/AIDS strategy for the United States. It was significant for a number of reasons, because as the United States supports efforts in throughout the world, we have never had a national AIDS strategy. And one of the requirements for other countries to receive help is that they have a national AIDS strategy. So now we're in line with what we demand others to do.
Why didn't we have a strategy?
It has never been a priority of previous presidents to the extent of moving it to this level. I simply will have to say it has lacked the political will. Now, this president has come forward, and on, as I said, July 13th, he released the strategy. There at the White House, I was in attendance, where he talked about his vision. And I just want to read the words very briefly, but I think it's powerful. The president said, the vision for the National HIV/AIDS strategy. The United States will become a place where new HIV infections are rare, and when they do occur, every person, regardless of age, gender, race, ethnicity, sexual orientation, gender identity, or socioeconomic circumstance, will have unfettered access to high-quality, life-extending care, free from stigma and discrimination. Now, that's a powerful statement. So now we're looking to live up to it. Where we are now, the president has called up on the main federal agencies that are involved with allocating resources to this disease to come up with an implementation plan, 150 days. So by December 9th, I think there are about 6 leading federal agencies with some others backing them up. They must come up with this implementation plan of how they are going to move forward on 3 essential goals. 1, reducing the incidence of HIV by some 25% by 2015. 2, increasing access to care and treatment. And 3, reducing health disparities, which we know in the African American community is a major part of our efforts to reduce incidence, addressing overall health disparities because of the influence or the impact of other diseases on HIV. So the goals are right in line with where we need to go, and what we must now do as a community is to stay engaged. We must make sure that we're on target with the finalization of these implementation plans. What are they saying to make sure that they address the issues within the black community? For example, we know the increase of HIV, especially among African American heterosexual women. African American heterosexual women represent some 66% of all of the new cases of HIV among all women. Now, we've got to see something in that plan that will help us. We've made some recommendations, for example. We believe that the Center for Disease Control, which tracks these diseases and make the necessary reports, should create a surveillance system that captures more information about Black women. How are Black women becoming more infected? We know it's through sexual intercourse. We know that, but with the increased number of African American men coming out of prison, with the increased number of men who have sex with men within the Black community, we want to be able to better identify what are the sources. Then from there, we can plan and develop more appropriate or effective responses to the problem. We also believe that there needs to be a national media campaign that focuses on African American women at every level in terms of economics, education, geographic, where they live, and this has to be over a sustained period of time. You can't do a hit and miss on this. Do it this month, do it the next month. It's got to be sustained, 5 years, 10 years, so that we can get the attention. So those are some of the things that we are advancing. We recognize the increase among Black gay men at the top of the list. So we have to make sure that we are targeting resources into these areas where the problems are the greatest. And I think that's certainly a major part of the emphasis of this strategy.
What are the statistics now in terms of the pervasiveness of HIV/AIDS in the African American community?
We're still seeing, based on a report from the CDC, Center for Disease Control, that annually we're seeing new incidents of about 56,000 new infections, and over 50% of those are within and among the African American population.
And that number, how many are with women?
That's where we see 66% of the new cases among all women being that of African American women. So African Americans are still leading, whether we're talking Black gay men, heterosexual Black women, or Black female, male, intravenous drug users, even though we have seen a tremendous decrease in terms of the transmission of HIV through drug use. So we are making progress. We've certainly made progress with respect to the transmission between mother and child because of the drugs and because of the medication and because of the research that was done in order to address that issue much earlier, and legislation right in this state of New York that was passed. So we've made progress, but we have so much more to do because, one, complacency. There's a sense that HIV and AIDS is no longer a problem, and I'm here today to say it's alive and it is well.
It's a big problem.
It is a big problem. Two, the belief that if one becomes infected, all they have to do is pop a pill and they will be okay, because they look at people, say, like Magic Johnson and others who look okay. But there's a whole lot related to taking a medication for the rest of your life and the impact that that could have, and you know, that threatened by other diseases also. So in discrimination and stigma, high, we can do and we must do more about that in our own community.
Well, what about the Black churches? Because AIDS is related to sexual behavior. There have been a lot of myths that have been perpetuated. People sometimes don't want safe sex. They think if they do certain kind of things, they won't get HIV/AIDS. How is that working out now? Because one of the initial activities of the Black Leadership Commission on AIDS was to reach out to the churches, because some of the churches were resisting even identifying HIV/AIDS as a problem. Now that we've identified that, what's happening, let's say, with safe sex and use of protection? How the church is relating to that? We
are seeing churches and faith leaders step up, thank God, because they recognize that we cannot have, faith leaders cannot have their heads in the sand about this. And safe sex works, use of condoms, to be able to talk about that from the pulpit. We're fortunate here in New York City that the New York City Council supports a program, Communities of Color, that provides funding for the National Black Leadership Commission on AIDS and the Latino Commission on AIDS to work with a large number of faith-based institutions and community-based organizations. And through that initiative, we have seen a real breakthrough. More ministers now have HIV ministries in their church and or health committees with a focus on HIV. More of them are talking about HIV boldly from the pulpit, encouraging their congregants to get tested, to be better informed, and to take this seriously. More are now engaged with doing one of 5 things throughout the year around national days like National HIV Black Awareness Day, which is in February, Week of Prayer for the Healing of AIDS, which is in March, National Testing Day, which is in June, National Latino Awareness Day, which actually is today, and then World AIDS Day. So you see them at least organizing and making certain that they are saying something or engaged in some activity to increase awareness, to educate people, and to help keep the focus on HIV. You know, Roscoe, and certainly as one of the founders of the National Black Leadership Commission on AIDS, the important role of our churches in our Black community. That is still where so many of us hear the message and receive it very different than what we would receive, say, even from the Center for Disease Control. Good, bad, right, or wrong, that's just the way it is. So that to the extent that we keep our faith leaders involved, that is so important. And we're doing that here in the city of New York. We now have affiliates in 11 cities across the country, and Atlanta, Tampa, Detroit, Washington, D.C., 6 cities throughout the state of New York. And now we're looking at hopefully starting affiliates in Chicago and in Houston. And all of these cities are areas where there are high incidence. Actually, we could just close our eyes and put a dart on the map and go into any city, and you're going to have high incidence of rates among African Americans to the extent that they live in that city.
Well, the National Black Leadership Commission on AIDS started in 1987 when nobody was really identifying with this issue, and under the leadership of Calvin Presley and Deborah Fraser Howes and Calvin Butts and C. Virginia Fields. People know about AIDS now. They know about BLACA, they know about the Black Leadership Commission on AIDS, and they know about the problem. On the other side, our brothers and sisters in Africa have a tremendous problem. So much so that the Clinton Foundation is having a meeting about the global initiative to deal with AIDS, particularly in South Africa, where for a long time it was just a denial that it existed. And finally, the administration has come around. How are some of the lessons we learned in the United States being applied to the global attack on AIDS?
Well, due to a special program known as PEPFAR, it was actually started under President Bush, or I should say, he certainly did give a great deal of resources to that, and that has been continued now under President Obama to provide resources a lot, certainly for medication, which is very important in many of our African countries. They have waiting lists almost to the point where another person cannot receive medication until someone else dies and create some space for that individual to come into the process for getting medication. The lessons learned from this country, I think, has been more about collaborations, needing to partner to make sure that the medications are important, but they also have to focus on other issues related to health education, literacy. So we see a lot of discussion through the Clinton Global Initiative, which is taking place in New York City. The entire day was spent focused on women and health-related issues, with HIV and AIDS being central to the discussions. And as I listened to the person now, Eric Gooseby, Dr. Eric Gooseby, who is heading up the the Global Initiative, talk about what they are doing, I think the collaborations, the partnerships as a model, working at the community level the same way we do it through the National Black Leadership Commission on AIDS, all and education and outreach. All of that is tremendously important, and it's not just the medications alone. We know that's important, but through the Gates Foundation, other groups like Coca-Cola that has been extremely active in terms of addressing HIV/AIDS globally, we're seeing many similarities as I hear people from other countries talk about this. I would also add, I don't think we talked about, and had a chance to talk with you since Dr. Butts and I attended and participated in a major high-level religious leaders summit in the Netherlands earlier this year.
Very interesting.
Dr. Butts was invited as one of 60 religious leaders from around the world to come together for a 3-day summit to look at the role of faith leaders, especially as it relates to stigma and discrimination. And I accompanied him on that trip to the Netherlands. And it was a very profound experience from the standpoint of hearing and seeing how engaged leaders from other parts of the world, Jewish leaders, Hindu leaders, Muslim leaders, Christians, all of your different faiths there with one common agenda. How do we lead on this? And out of that, they came out with an agreement of a covenant where they all committed to do more to fight this epidemic, especially as it relates to stigma and discrimination. You had some bishops there who had been excommunicated from their own base because they are positive. But they've not given up, and as a result, they have built that ground support that has led them back into leaders in the church because they were recognized for what they are doing. So across the world, throughout the world, and now we must focus here domestically in the same way as I've seen a lot of this happen globally, and that's what we're doing. And the National Black Leadership Commission on AIDS is happy to be a part of this leadership, raising the awareness, sounding the alarm, and making certain that this remains at the top of the agenda.
Well, you have two things. One, you have to deal with the stigma, and the other, you have to deal with the lack of knowledge. And those two things feed into each other. At one time, it was thought that getting HIV or getting AIDS was a mark of death. Now, with the medications done right, people can live long lives. To what extent is the research keeping ahead of the disease?
Not sufficiently enough. I heard or read about a couple of months ago when there was an article actually in the Times about one of the impact of HIV/AIDS in one of the African countries, and one of our leading researchers here at the National Institute of Health said that a vaccine is a long ways off. Now, that was not encouraging for me to hear that, that a vaccine is such a long ways off. I think we have to speed up the research there, and that's part of the advocacy that I think we also must be engaged. Now, coming from Tuskegee, Airmen, you know all about what happened there with the syphilis and so forth, but we are not seeing enough African Americans agreeing to vaccine trials, participating in the vaccine trials. And we need that to happen in order to better understand the impact of this disease on African Americans, because we know that it affects people in racial ethnic groups different. So we're trying to scale that up. We're trying to give people information so that ultimately they will have to make the decision. But good information. Why is it important for African Americans to participate in these trials? So that we can see the development of some vaccines that address particular strands that might be more impactful among African Americans than other racial ethnic groups. We've got to keep research in the forefront, just as we do education. We're pushing to have, sexual reproductive health as a major part of curriculums in our public schools. The same way we need to be pushing for research and reports from the National Institute of Health as to what are they doing in order to advance this more research and effective response to this problem.
It seems like keeping the visibility on the AIDS problem is one of our main concerns, because of Magic Johnson and the so-called drugs that will improve, treat AIDS. People say, well, it's not too bad. I'll get over it. Right. Don't worry about it. That, of course, is not true. They will live and they will have to take medication the rest of their lives. But how do we get the African-American community, the national community, to keep AIDS in focus? You're doing a good job, but how do you keep that? Yeah.
It has to be through sustained outreach efforts. Sometimes I feel like a broken record myself, or a broken CD these days. Keeping the message out there, staying in the forefront, using every opportunity to raise the awareness through our churches, through our historical black colleges
and through the media, like African American legends.
That's why I love you, Roscoe, because you continually have someone, myself and others, on talking about, but that's what we have to do. I liken it to, and I often say this, and my staff, when they see this, they say, yes, we've heard it, and that is, as elected officials, we know how to get elected. We get our messages out there. We do what we call retail politics. We're on the ground. We're in the beauty salons. We're in the barbershops. We're in the housing developments. We're on the blocks. We have the literature out there. We've got to do similar kinds of things to get people's attention. Once we get the attention, we're in a better position to educate, encourage people to get tested, to know their status, to engage in safe sex, the use of condoms. We need to get their attention. So we've got to do more in that area and getting their attention, and it's ongoing. It's not a one-time thing that you do, then go away. You can't just put a media advertisement or use, do this one time, a video one time, and assume that people get it. So it's ongoing, it's education, it's outreach, it's knowing where the major incidents are, and through mapping at the local level, we can identify those zip codes where we have higher incidents, new cases, and prevalence of people who are living with the disease. We've got to do that more and then concentrate our resources in those areas. And that's what I was saying with the National AIDS Strategy. Talks about it throughout. Putting the resources into communities of greatest need. Now, we have to make sure that that happens, because if that's done, it will direct those resources in the Black and Latino communities.
Now, if someone watching this program has been so motivated by understanding the problem, how can they contact the Black Leadership Commission on AIDS to get some materials about programs, etc.?
We have a newly designed website, and I encourage people to go on it. It's much more interactive, and we ask for opinions and suggestions. www.nblca.org. And there they will see how to contact us. make recommendations, give suggestions, and we encourage people to contact us. We don't have all the answers, and we don't, proclaim to, but we want to be broad-based in our outreach. I mean, I talk about this everywhere I go. They start calling me the AIDS czar. Here she comes, But it is so incredibly important that we hear the message, that we listen, that we get educated, we become involved, that we become tested, and then we spread the word. In the Black community, the broader community must be engaged and concerned about Black gay men, Black men who have sex with men, heterosexual, Black women, female and male intravenous drug users.
Who are some of your celebrity spokesmen about AIDS in the Black community?
Well, we're seeing a number step up now. Jamie Foxx is certainly out there saying a lot about it. We're, pleased with that. What we're seeing more with the Black celebrities like Alicia Keys and others, they're more of a spokesperson on the global scene than the domestic scene. And we're trying to change that. We are looking for that voice, like a Will Smith, a Jada, I mean, people look to these individuals. They look to a Beyonce, so that those voices would really, resonate. But right now we're seeing more of our Black celebrities speaking on the global scene. Of course, Cheryl Ralph is very much involved.
And of course, we have Virginia Fields, the CEO of the National Black Leadership Commission on AIDS. And today on African American Legends, we've been talking about the importance of the fight against AIDS in the Black community and in the world. Thanks for being with us today, Virginia.
Thank you, Roscoe, so very much.